If your jaw clicks, pops, shifts, or locks while eating and talking, this could be your body trying to warn you. And no, just because it happens to everybody does not make it normal. These signs are often indication of underlying temporomandibular joint disorders. Over time, this degeneration can lead to facial pain, headaches, ear pain, jaw deviation, and even reduced mouth opening. Identification of the underlying cause and prompt management is extremely important to prevent this degenerative disease from progressing. To know more, read the caption below.